Hello, everybody. It's been a few days since I've been able to get on. There's been some random stuff happening in my life, and I'm just trying to take one step at a time to get through it. So I'm back at it. We're doing how to be your own therapist, and let's get right to it. Number 4, engaging with life. In my career, I've been lucky enough to work alongside some exceptional people. People who care, people with incredible skills and empathy. As therapists, we have supervisors who are also therapists. Every therapist talks to another therapist to get the support. It's like a daisy chain of support. In one of my NHS jobs, I was supervised by a very intelligent and skilled psychiatrist. He was diagnostically sharp. I learned a lot from him about psychiatric disorders, the importance of assessment, and the role of medication with some people. He was also brutally honest, which I really liked. I remember a discussion with him about a patient, Philomena, who was struggling with severe anxiety and depression. I had tried every technique, and I was getting nowhere. I was feeling defeated and a little lost. My perfectionist rules and beliefs were winning out over adaptive thinking. My supervisor looked at me and asked, "Have you tried life with this patient?" Initially, I was baffled. He went on to say, "The antidote to pain is life." I asked him to elaborate, and he replied, "Is your patient engaging with any aspect of life? Work, socializing, exercise, volunteering, a walk, a hobby, gardening?" And there, a sudden light bulb moment. Philomena was naturally disengaging from most of her life, but she loved gardening. I short-sightedly hadn't considered it to be part of treatment. My supervisor suggested I ease up on all of the techniques and encourage Philomena to connect with her gardening, and that's exactly what I did. Any luck would have it, my job at the time was close to a gardening center, and they were seeking volunteers. Fast forward 4 weeks. Following a lot of persuasion and patience, Philomena started her training there. Everything changed. She came alive in our sessions. Within weeks, her symptoms improved. She became motivated. Her eyes sparkled. There was a lit in her voice that I've never heard before. She had found the antidote to pain, gardening. This experience changed how I work as a therapist. Of course, we need to follow a process and use the therapeutic techniques, but we must include life in the treatment plan. Whether it's through a gym, a book club, Zumba, birdwatching, fishing, or something else completely, all of life offers healing if we can find something to connect to. And now I put this question to you. How engaged are you with life? Stay with this question. Take time with it. Don't rush. If you're going through a tough time right now, that's okay. Is there one part of life you could connect with a little more? It might feel difficult and you may need to start slowly, but that's fine. If you like walking, go for a 5-minute walk today. It's a start. If you like nature, go look at a tree today. It's a start. If you can do more, great. Do what you can. When you connect with what interests or matters to you, your body releases the feel-good hormones serotonin, oxytocin, and dopamine. You start to feel more connected to other people. Your motivation improves. Negative patterns crop up less and less frequently. You begin to heal. Today, I challenge you to take one step forward, re-engaging with your life, particularly if you have been avoiding it. The antidote to pain is life. Has become something of a mantra for me. I think about it often. Maybe it can perform the same function for you. The solutions you are seeking are likely to be closer than you think. The 4 commitments to self. We now move on to look at what I call the 4 commitments to self. These are more of an internal job, a change of perspective, if you like. You may be surprised at how deceptively simple yet empowering they are. They involve a shakeup of your approach to yourself. The 4 commitments are: 1. Talking to yourself as though you are someone who matters, because you do matter. 2. Looking after yourself. 3. Going easy on yourself. 4. Showing up in your life authentically. On average, most people feel that if they were rated for how well they performed in each of these areas, would get a very low score. I meet people from every walk of life in my line of work. The one common factor I see every day, people don't treat themselves well. I believe this is unquestionably the crux of the human struggle. The most consistent part of your life is you. You will have you with until your last breath. How you speak to yourself, how you treat yourself, how you look after yourself are symbols for your life. Whatever life throws at you, if you are in good company with yourself, then the journey will be so much more manageable and enjoyable. I went traveling to the US in my 20s. A cliche, I know. Partway through my trip, I met a fellow backpacker, and we agreed to travel together for a month. But after 1 week, I was exhausted. He was negative. He complained about everything. He was critical. He was unappreciative. He was also very rude to most people he interacted with. I tried hard to be compassionate, but I realized I couldn't travel for a full month with him. After the first week, I told him I'm going to travel alone, and that's what I did. Even though I was anxious about solo traveling, I realized I could rely on the part of me that was kind, curious, open to adventure, and generally keen to have a good time. I could be alone with myself. In life, we need to learn how to become solo travelers because sometimes we might unexpectedly be alone or circumstances might change. We need to learn the skill of being able to talk to ourselves in a positive manner. We need to learn how to look after ourselves. We need to learn how to be compassionate to ourselves. We need to be able to show up in the world comfortable in our own skin. When we live this way, we are just better to life's uncertainties and unpredictability. It's like living life in the presence of a reliable best friend, and that best friend is you. Talking to yourself as though you're someone who matters, because you do matter. We all have a running internal dialogue. Take a minute to stop and notice the chatter. It tends to sound something like, why did he say that? Does my boss like me? Is my partner bored with me? I'm too fat? I wish I was a better mom, better dad. And on it goes. Our internal voice towards ourselves can often be destructive, harmful, judgmental, even cruel. Clients often describe negative events in their life to me, events like conflict, hardship, loss, or heartache, as they're describing these events. I always ask one question: how are you talking to yourself in this moment? These are the types of responses I hear almost every time. I'm such an idiot. I'm stupid. This is my fault. I'm pathetic. I'm a waste of space. I'm useless. I'm a fool. I'm a insert endless list of exploits. People talk to themselves like they don't matter. And that's exactly how that kind of internal chatter leaves them feeling. Our emotional response correlates with the tone and language we use towards ourselves. If this is striking a chord with you, I have one suggestion. Work on paying attention to the tone of your internal chatter. As soon as you feel it turning negative, shut that voice down. Calmly and firmly tell it to stop. You deserve better. Once you've accepted that you matter, then you owe it to yourself to talk to yourself like you do. Change your tone, change your language, talk to yourself the way you would talk to someone you respect. The transformation will be instantaneous. 2. Looking after yourself. It might sound a little odd that I'm including this as part of my therapy, but it's crucial. Self-care isn't high on the agenda for most people. I often deliver talks on mental health to large organizations. I'll start by asking how many people have devoted time to self-care that day. On average, I'm lucky if a dozen people raise their hand, and that can be a room of 500 people. Before we continue, let's first define self-care. Self-care is the act of looking after yourself physically, physiologically, emotionally, or even spiritually. It doesn't necessarily mean taking a bath or having a massage, although it can mean both or either of these things if that's what you really need. Eating a healthy diet, exercising, wrestling, mindfulness, of meditation, seeing friends and family, and practicing gratitude are all forms of self-care. I encourage you to think of self-care broadly and evaluate truthfully how you look after yourself every day. Here's some of the questions to ponder. How does your diet support a healthy lifestyle? Do you manage to include some physical exercise within your capabilities into your day? Do you create breaks within your day? Do you engage in anything that helps quiet your mind? Do you talk about issues that are bothering you? How often are you connecting socially with others? Do you feel there's a balance between your work and your non-work life? Do you prioritize other people's needs before your own? Do you express appreciation for the positives in your day? Self-care can sometimes be misunderstood or portrayed as selfish, a luxury, or unrealistic considering the demands of modern life. I would challenge this. Self-care is essential for healthy daily functioning. It's responsible. It not only helps you get the best from your life, but others also experience the best of you. It is a powerful statement that you value and respect yourself. You are taking responsibility and ownership for your life. Earlier, we discussed the impact of how you talk to yourself on how you feel about yourself. Self-care, or the lack of it, has a similar effect. Self-care is a therapeutic act. You are showing up in your life and deciding that you deserve looking after. Without self-care, the risk of exhaustion, burnout, breakdown, call it what you like, increases significantly. There's nothing fluffy or self-indulgent about self-care. It needs to be taken seriously. I see the darker side of people ignoring the warnings from their body that they need to take care of themselves. You have the choice to proactively change this today. Go easy on yourself. I noticed a few years back that when I asked clients about self-compassion, they often threw me in a suspicious glance. It could translate to, what snowflake wizardry is this man talking about? That's when I started phrasing the question differently. Do you give yourself a hard time? To that question, I'd almost always get a resounding yes. I started following that question up with another. Do you think life would be easy if you did less of that? Again, a resounding yes. This is the point of which I now suggest we talk about self-compassion. Self-compassion is broader than how you talk to yourself. It's a much deeper level of self-care that is both mindset and action-based. It means employing self-acceptance and warmth. It means dialing down the judgment and learning to confront yourself in darker times. It means saying, it's okay, we can do this, and I'm with you, to yourself when it seems impossible. It means asking yourself the question, what do you need? Self-compassion means you instinctively learn when to leap into action and when to stop, when to advocate for yourself and when to protect yourself. Example, let's take a break. I'm taking you away for a holiday. I want you to see less of these people, or let's go out for a walk and switch off for a while. If I were focused to choose just one tool as a therapist, it would be self-compassion. Let me explain why. As humans, we make mistakes. We screw up, sometimes fail. We fall, we experience exhaustion, and we are imperfect. And we can persecute ourselves for all of that. Self-compassion is powerful because it means accepting and sitting in our flawed humanity, because this is very difficult for most people. Practicing self-compassion tends to cut right to the source of our issues. You learn to get to know the enemies within yourself and approach them with greater understanding, lightness, and openness. Self-compassion means embracing life as it is and yourself as you are. Now, it's not conditional on success, achievements, or accolades. If you're someone who gives yourself a hard time, try a self-compassionate approach. Is it a loyal, faithful companion that you can access at any time and it won't let you down? 4. Showing up in your life authentically. In a society that's obsessed with creating the illusion of perfect lives, perfect bodies, perfect relationships, perfect teeth, and so on, I propose a different route. Simply show up unapologetically as you are. I wholeheartedly believe that when we try to create an illusion that is at odds with who we are, we weaken our position. People sense authenticity immediately. We can feel it when we are around people who aren't sincere or genuine. If an authentic approach doesn't get you what you want, perhaps you are on the wrong path. If you dilute, minimize, or fabricate who you are, you compromise your integrity and the foundation supporting you. I remember once being advised by a friend not to talk too much about my own struggles in book interviews because people don't want advice from a therapist who has struggled. I disagree and choose not to adapt my approach. I am good at my job, partly because I personally have known and understand human struggle. Why would I hide that? The best professionals in health and psychology are often those people who have walked the path. I'm not advocating that you shouldn't strive for self-improvement, personal growth, or fulfill you and help to augment those aspects of your personality. And identify and make sure that you feel special and unique. All I ask is that you avoid the trap of being you need to be different from who you are. You don't. Commit to your authentic self. It won't let you down. All right, so we're on to part 2. All right, thanks for listening, guys. I will keep trying my best to improve myself, as well as just be part of stuff. Thanks.